Hey, good morning, everyone. Just setting up here. All right. Good morning. Happy Saturday, everybody. Getting ready to start. Okay, I'm doing this. Hey, Danielle. Good morning. Eric. Okay, I'm doing this from my phone, so have a little patience with me. Um, I have a new laptop and I can't get the camera to work on Facebook, so I'm going to do it from the phone. Good morning, Leanne. How are you? EB, my buddy, how are you doing? Big shout out to all the people that are up early. Well, not that early on a Saturday morning. Good morning, John. How are you? Okay, so today's topic is growth hormone. Is it really the fountain of youth? I'm kind of continuing on my series of videos on hormone replacement therapy and hormones in general. We did thyroid, we did testosterone, and now we're going to do growth hormone. So let's get started. Good morning, Dolores. So growth hormone. Growth hormone is also known as somatotropin. It's produced by the anterior pituitary gland, which sits at the base of the brain. And it's kind of thought of as the master hormone for your body. It controls a lot of the bodily functions and the organs and the cells in every part of your body. So that's why it's considered the master hormone. So interestingly enough, growth hormone is kind of misnamed. It's responsible for growth only in the early years. So up until about the age of 18 to 21, when the growth plates close, you produce growth hormone. It stimulates bone growth. But once the bones stop growing, the growth plates close. The growth hormone still has a lot of effects on the body and is very vital to your overall health. So it's kind of a little misnamed that it's as growth hormone. Good morning, Mike. How are you? And so it's really misnamed. I think I like to call it the human healing hormone because you'll see it really replenishes all the cells in your body. So growth hormone is produced by the pituitary. And interestingly enough, good morning, Del. How are you? Good morning, Michelle. Devin. So growth hormone has two ways of affecting the body. One, growth hormone has its own receptors itself all over the body, brain, heart, tissue, everywhere basically in the body. And then the second way, it's transformed in the liver and in the tissues to IGF-1 or insulin-like growth factor. And this has both growth hormone and insulin-like growth factor have a tremendous effect on a lot of the functions of your body. So your growth hormone is produced obviously a lot in youth, and as you get older, there's something called somatopause. I don't know if you guys can see this or if it's backwards on the phone. So somatopause, it's kind of like menopause or andropause, is what doctors describe as the decline in growth hormone as we age. Now, interestingly enough, somatopause really starts really around the age of 30, where growth hormone levels really begin to decline. And if anybody here over 30 years old realizes that when you reach 30 and then you reach 40 and then you reach 50, each of these milestones, you start to see your body's resilience decline. So I think it's really important that you get a baseline level of growth hormone. And the way it's tested in the blood is actually indirectly by testing IGF-1. Since growth hormone is produced in spurts, mostly during sleep, it's very hard to capture growth hormone levels reliably in a blood test. So because it's produced in spurts, and then A lot of it gets converted in the liver and tissues to IGF-1. So an indirect way of measuring growth hormone is through measuring IGF-1. Again, it's really a good way for getting a baseline of what your growth hormone status is, and then if you're on therapies, which I'll go through later, it's a great way of monitoring. So what are the functions of growth hormone? So the functions of growth hormone are vast, so I'm going to spend a lot of time on this. According to the textbooks on endocrinology, one of the most profound effects that growth hormone has on the body is on glucose and lipid metabolism. So why is that important? You notice as you get older, your cholesterol gets a little bit higher, your blood sugars may or may not get a little bit higher. They're more difficult to control. You have to be more conscious of how much sugar you eat. And that's because of growth hormone's effects on lipids and on glucose. And that's right from the medical textbooks. Most of what I'm going to be talking about as far as physiology today comes right from endocrinology textbooks. So it also has a vital role in lean body mass and muscle mass. So as we get older, we tend to lose muscle mass. And that's one of the reasons why you gain 3 to 5 pounds yearly, is because as you lose body mass, your metabolic rate is strictly dependent on how much lean body mass you have. In other words, if you have a lot of lean muscle, your metabolism is faster. If you have less lean muscle, your metabolism is slower. So the amount of calories that you burn at rest is directly related to the amount of lean body mass you have. So as lean body mass goes down as you age, your metabolic rate slows down. So the calories you burn at rest are less. So why exercise becomes more vital as you get older. Interestingly enough is that in a study that I recently looked up, high levels of glucose or high blood sugar, so as seen in diabetics, actually inhibits growth hormone secretion. So you can imagine like the snowball effect that this would have on somebody with diabetes. They have diabetes, they have less growth hormone, less lean body mass, which leads to lower metabolic rate, which leads to increased fat gain, which leads to increased blood sugar. So you can see how that really will start to snowball and cause these diabetics to get worse and worse and worse. So, hey, Tony D'Elia from California, nice to see you on here. So, interestingly enough, I'm going to give some of the physiology. So here's my little card on this. If it's backwards, I apologize because I plan to do this on the computer. Increases in blood sugar cause decreases in growth hormone secretion. So that's very important. So that's why it's important to, hey, Val, good morning. That's why it's important to really monitor your blood sugars. So let me talk about telomeres. So most of the studies on anti-aging and cellular health are dependent on something called a telomere. A telomere is a material that is at the end of each one of your chromosomes, which sit in the nucleus of your cells. All cells in your body contain your chromosomes. So the telomere, think of your chromosome as a shoelace. And the telomere is that little plastic which is called an aglet, I believe, the plastic thing at the end of your shoelace, right? So that's the telomere. So picture an old shoelace, right? As that plastic wears away and eventually disappears, right? The shoelace becomes tattered and worn and eventually doesn't work anymore. So from cellular damage as opposed to oxidative stress. So oxidative stress is all the things that we're exposed to in life, from poor diet to chemicals in the body to stress. All of these things cause oxidative stress in the body. Oxidative stress decreases telomere length. So as the telomere shortens, the cell's ability to reproduce itself will decrease. As the telomere lengthens or stays the same, aging or cellular reproduction increases. Aging decreases, but cellular reproduction increases. So there's an enzyme called telomerase, Telomerase, if you're looking it up, and it regulates telomere length. So the more telomerase, which is an enzyme that ASE is an enzyme that cuts down things, right? So telomerase is making the telomere shorter. So in an article in 2009 in the Journal of Endocrinology, there was an interesting study that showed that the telomerase, which is the enzyme that controls telomere length. Here's a good question. The first question: what about marriage? Does that lead to aging? I'm going to leave that one up to you, Val. I'm not going to answer that one. Hey, my dad is on. Everybody say hi to Pops Lucente. He's the ultimate poster boy for anti-aging. He looks great, 72 years old. If anybody's ever seen him in the gym, he's amazing. And my brother just popped on too. So welcome everybody. So in this study, they found that growth hormone specifically actually decreases the effects of telomerase, which will lengthen the telomere. So it's been proven that growth hormone will actually increase telomere length, or at least will reduce the telomere from shortening. So when it comes down to science, growth hormone will actually decrease the aging process by increasing cellular reproduction. So what are we talking about in cellular reproduction? What kind of cells reproduce all the time? Well, most of the cells in your body, but more importantly, hair cells, right? Skin cells, heart cells, immune cells, also your hormone cells, so cells that produce your own hormones in your body. And a lot of these effects are what you see when you take growth hormone therapy. So let me talk about the effects of growth hormone. So the title of this talk is growth hormone the fountain of youth? So here are the documented effects of growth hormone therapy and the documented effects of growth hormone in general in the body. Cellular renewal, right? So the cellular renewal is the most important thing because this is what really basically causes all the effects in your body. Improve sleep. Growth hormone is produced in the deep stages of sleep, which is also known as REM sleep. So REM sleep is when you're dreaming in general. That means if you're dreaming, you're in the deep phases of sleep, and especially if you remember your dreams. And I'm sure a lot of you've noticed that as you get older, you tend to dream less and you tend to remember your dreams less. And if you look at things like alcohol and other sedatives like Ambien or other sleep aids, what they do is they're sedatives. They actually knock you out. They put you to sleep. But if you've ever noticed, you don't really dream when you're on a sedative. So many people out there take Ambien or other aids to sleep, but it's not really putting you in restorative sleep. And that will, if you're not in restorative sleep, your body's not producing growth hormone. So growth hormone in and of itself will help itself by improving sleep and then improving more growth hormone release. So that's a really, really important point. We know about the mitochondria. If anybody knows about cellular health, the mitochondria is the powerhouse or the energy source of every cell in your body. So growth hormone, because it increases the number of cells and the number of mitochondria, will increase your overall energy levels. It increases stamina. Ladies, it increases hair length and thickness. It increases skin elasticity. It increases nail growth. It can increase eyelash growth. So it's a wonderful, wonderful thing. It improves muscle definition by decreasing catabolic effects of the body. So in other words, catabolism is the breakdown of muscle. Anabolism is the building of muscle. Growth hormone can enhance focus. So it enhances focus by keeping your brain cells healthy. It improves lipid and sugar metabolism, which I discussed before. It increases fat loss. It decreases inflammation. That's a really important one. Decreasing inflammation. Inflammation in and of itself is what causes every single disease known to man. Almost every disease is caused by inflammation. And what causes inflammation? Inflammation is caused by cellular damage, oxidative damage, right? We take antioxidants, vitamins, minerals to decrease oxidative stress. So growth hormone in and of itself decreases oxidative stress. Here's a question. I see Al Lucente's on, Barbara Marcello, very welcome. Here's a question. I'm gonna, if you have questions, just pop them in. I'm gonna try to answer them right away. Does exercise increase growth hormone? Yes, exercising will modestly increase growth hormone. And I'm going to touch on some other things on how you can increase your growth hormone, both naturally and with supplements and with medications. Increased libido, decreased, good morning, John, decreased menopause symptoms. So those of you who are perimenopausal, if you're having hot flashes, growth hormone therapy has been shown to really supplement the effects of the other hormones circulating in your body. So if you're a male and you're on testosterone replacement therapy, or you're female and you're on estrogen replacement therapy, it will definitely enhance those effects. But in and of itself, it will decrease hot flashes and decrease the effects of menopause. Decreases in muscle soreness. So if you're going to the gym, growth hormone is a restorative hormone. It increases muscle repair. Again, if you notice, these are all the things, all of the effects are from the effects of the telomere not getting shorter. It's the effects of cells replenishing themselves. As you age, cells do not replenish themselves as well. That's why your skin gets loose, your hair starts to fall out, your energy levels go down, your immune function goes down. So another effect is that it will increase your immune system function. So immune cells will be more active. Here's another question. Does it enhance cells like cancer? Most of you do not have cancer cells floating around, and I am going to have a separate section here on cancer, and I'll address that later. But in general, and this goes along, and the reason I'm mentioning now, you have cells in your immune system called natural killer cells. Natural killer cells are the circulating cells that actually, if you're exposed to a carcinogen, natural killer cells are the cells that will actually gobble up cancer, potentially dangerous cells. So by enhancing immune function, you will naturally decrease your risk of getting cancer. And that's logical because if you look at pediatric cancer versus adult cancer, we know that as we get older and we have less growth hormone, we actually see increases in cancer. That being said, I'm going to touch on later, if you do have cancer or have had cancer in the past, it can be dangerous, it can be controversial to take, especially the growth hormone injections. Good morning, Al Lucente, Al Ciano. Betsy is here. Betsy, where are you from? Shout out where you're from. If you're on here, like the video. Tell us where you're calling in from or watching from. Last thing, wound and bone healing. This is also well documented in the literature. Fractures, if you have a bone fracture, growth hormone will actually decrease the time you need for healing. Wound healing. Houston, Texas. All right, great. So I'm going to have to say I'm a Yankee fan, not rooting for the Astros, but love Houston, Texas. Metabolism, bone healing, wound healing. I was on growth hormone therapy many years ago on the injection, and now currently I use a different product. But one thing I noticed is I had a couple of cuts on my arm, and the heals, the wounds heal just so quickly. You'll notice that if you cut yourself or you have an injury, the amount of healing time is reduced drastically, and this is also proven in the literature. So who else is impressed by the amount of great things that growth hormone can do? It's certainly a wonderful thing. However, now I'm going to get to how can we raise growth hormone levels, right? So you heard about all these wonderful things. How do we raise growth hormone levels? Before I get to that, I just want to touch on cancer. So there have been studies that have shown that certain cancers are responsive or have receptors for growth hormone. One of those cancers are breast cancer. A second one is colon, and then a third one that's questionable is prostate cancer. But again, if you have active cancer, you definitely don't want to take growth hormone. That does not mean that you can't naturally improve growth hormone in your own body, but if you're going to think about taking growth hormone injections, it's definitely a contraindication. That being said, if let's say you had prostate cancer and you had your prostate removed and there's no signs of cancer, there's no reason why you couldn't ask your doctor if you can take it. If you've had colon cancer or breast cancer, unfortunately, you're not a candidate for growth hormone therapy. But if you do not have cancer, it does not increase your risk of cancer. So again, I'm going to repeat that. Taking growth hormone therapy does not increase your risk of getting cancer. In my opinion, and again, this is just my opinion, it improves immune function, and improved immune function will increase circulating natural killer cells and therefore decrease your risk of cancer. But again, anybody who has cancer or has had cancer should always ask their own doctor on what their opinion is of this. So, ask your doctor. Okay, so let's get into treatments, natural treatments. All right, let's start with diet. Okay, so I did a talk recently on intermittent fasting. So intermittent fasting and fasting in general are the only two diets that have been proven to increase growth hormone levels. So by eating less, the less calories you eat, the more growth hormone you produce. The more calories you eat, the less growth hormone you produce, especially when you're increasing blood sugar. And again, that's been proven. Vitamin therapies, there's A, B5, B12, folic acid, and I think the last one is inositol, which is another vitamin. Minerals that can increase growth hormone production are chromium, and I'm cheating, I'm looking at my notes, zinc, magnesium, and iodine. And we also know that iodine is important for thyroid function. Amino acids. So a lot of products out there claim to be growth hormone releasers. So some amino acids that can be beneficial in growth hormone production: glutamine, glycine, carnitine, arginine, taurine, ornithine, lysine, and GABA, GABA, which is also one of the therapies that I recommend if you have anxiety treatment. And I'm actually working with some people now that are really doing very well on GABA treatment. There are some herbs and plants, too many to mention, ginseng, some of them, some of ashwagandha. All of these things have shown modest improvements in growth hormone. None of the dietary or mineral or herbal treatments have really been shown to significantly increase growth hormone, but have shown modest increases. It does not hurt to take these things. If you do even get modest increases in growth hormone, will definitely improve your health. Let's talk about precursors. Precursors, again, or secretagogues that are out there, mostly are amino acids. A lot of them are just what they call proprietary blends of amino acids, and they don't necessarily have aren't FDA regulated. They aren't necessarily proven, but again, some studies show that you can have modest increases. There is a product out there called Semarelin. Semarelin, really very big in the bodybuilding world. It's GHRH, which is growth hormone releasing hormone. It's the hormone that's produced in the hypothalamus, which controls the pituitary. This is something that you should not fool around with on your own. It needs to be prescribed by a doctor. It's mostly used for diagnostic purposes to see if your body can release growth hormone. It's mostly used in children. Has a big black market following, very dangerous, should not be used unless you're really under the care of an endocrinologist. So Semarelin I would not recommend. And can have side effects of increasing growth hormone too much. You have to remember that if you're going to take growth hormone, that there is, you want to stay within physiologic ranges, and that's measured by IGF-1. And if you take too much growth hormone, like any other hormone, you're going to have side effects. If you stay within the natural range that is what your body is producing when you're young, you shouldn't have any side effects. So your body kind of regulates growth hormone on its own, and unless you have rare diseases like pituitary tumors or gigantism, where you have too much growth hormone, your body in general will regulate the amounts of growth hormone that's in your body. Let's talk about growth hormone injections. Growth hormone injections have been around for a long time, very popular in Hollywood. Most of the stars that you see that look great are probably on growth hormone therapy. So growth hormone therapy through injection has been around a long time. I have experience prescribing it to people for that purpose, for low growth hormone levels, measure IGF-1. IGF-1 is on the low end or below normal, and we replace it. Definitely produces all the great effects that we talked about. It's definitely effective because it is human growth hormone. The downside is it's injectable. You have to inject yourself every day. It's by prescription. It has to be monitored by a doctor or an endocrinologist. Hi Deb, nice to see you on here. Liz, welcome. Stephen. So growth hormone injections also need to be monitored carefully. It's very easily to take too much. The side effects of taking too much growth hormone, it can increase your blood sugar levels. It can stimulate other cells to grow, especially like organ cells. Your heart can enlarge. So this is mostly seen in the bodybuilding world and is really the side effects of growth hormone abuse and not therapy. However, it's also very expensive, as Eric just mentioned. Growth hormone therapies can range from $800 to $1,100 a month. So it's really not an option for most people. And again, it has to be carefully monitored. Some of the side effects besides increasing blood sugar are carpal tunnel syndrome, because it causes the tendons to actually get too tight in the wrists and can cause carpal tunnel syndrome. It can cause edema or swelling in the legs. Again, this is mostly seen with too much, but again, it takes a really qualified doctor to monitor this and to really watch you carefully. Although it's a very effective therapy, it can also be dangerous. There are sprays that are out there. Growth hormone sprays are definitely a way of a lower cost option. The FDA does not recognize sprays as a legitimate growth hormone treatment. Again, it's usually a combination of amino acids. It supposedly gets absorbed in the bloodstream under your tongue. I've had people on sprays that have come to me. We've tested IGF-1 levels. We have seen little to no increases. Some people feel better if you take the spray and you feel better. Can it be a placebo effect? Yes. Can it be a real effect? Yes. But again, it's not proven and not really regulated, so you have to be careful of what you're taking. Something interesting that just came out, and I've been doing a lot of research on, is there is a homeopathic growth hormone gel that came out probably about 5 or 6 years ago. It was mostly locally marketed, and now you're probably seeing more things about it on the internet and on Facebook. And as you know, I do not in these talks talk about specific brand names. If you have any questions about specific brands, about injection brands, about spray brands, be more than happy to talk to you through Facebook Messenger, and just reach out to me. Hi Jarrett, how are you? This gel, it's interesting, and I did a lot of research on it. So the gel is a homeopathic form of growth hormone. It's diluted human growth hormone. The science behind it is that in homeopathy there is a concept called microdosing for hormones, and what it does is it introduces tiny amounts of hormone that will stimulate, because your body works on a negative feedback mechanism like a thermostat. Your body will start seeing small amounts of human growth hormone circulating in your blood and say, hey, wow, this is good, let me produce more. So the gel will increase your own natural production of growth hormone. Interestingly enough, it does increase growth hormone, but does not significantly increase IGF-1. Why is that important? Because IGF-1 is really the thing that will cause increased levels of IGF-1 is what really causes the side effects of growth hormone, if you have any. Growth hormone in of itself, we know, like I mentioned earlier, that the body has its own growth hormones receptors, will produce all of the effects, the beneficial effects of growth hormone without having the detrimental side effects. The good thing about the gel is it's moderately priced, not very expensive, about 10 times less than the injection. And since it's homeopathic, your body will regulate itself and produce modest amounts of growth hormone, giving you the effects without any of the side effects. So far in my research, I have not seen really any side effects from the gel besides just local irritation, which is just really addressed by rotating sites. Other thing about the gel is that it is the one product in particular is registered with the FDA, so whatever is stated to be in the gel has to be there because the FDA will test batches and confirm what's in there. So this is important, especially for supplements, that if a supplement is registered with the FDA, it is tested for the product that's in there. In other words, if I put out a product and I go to a vitamin company and I say that there's 1,000 milligrams of vitamin C, if I'm not registered with the FDA, you have to take my word that I'm putting 1,000 milligrams of vitamin C in there. If you're registered with the FDA will be coming into my facility and testing and making sure that if I'm advertising that there's 1,000 milligrams of vitamin C, that there's actually 1,000 milligrams of vitamin C in there. So the gel is promising. I've seen tons of testimonials on it, so it's promising and probably the most promising therapy that I've seen. That's another option. So just to review, growth hormone is the master hormone of the body. It produces a lot of effects on improved cellular reproduction. In general, growth hormone is safe. If you are a cancer patient, you should talk to your doctor. Intermittent fasting and exercise are two great ways to naturally increase growth hormone. Supplements out there can work, and if you have benefits from them, that's great. There are little to no side effects with some of these supplements, but they are not FDA regulated. Here's a question: how much can exercise increase HGH, and what type of exercise? Any type of exercise, weight training and endurance exercises, strength training. Again, hard to really quantify. You could probably find some studies out there on the internet on exercise and growth hormone. One way you could do it is by getting a baseline IGF-1 level, starting an exercise program for a couple of months, and then seeing what your levels are afterwards. That would be the scientific way. But in general, exercise can modestly increase growth hormone production. Also, getting enough sleep and reducing the amount of toxins in your body, right? We saw that growth hormone improves cellular reproduction. Here's another question: can the gel interact with certain medications, particularly blood thinners? Well, growth hormone is already circulating in your bloodstream, so if growth hormone doesn't interact with your own the growth hormone that's already circulating in your blood, then it shouldn't interact with growth hormone taken outside. So this would only really apply to secretagogues. It would apply to growth hormone injection, and it would apply to the gel. So by increasing growth hormone through injection or through a gel or through a secretagogue, since it's the same growth hormone that's in your body, it shouldn't have any interactions. If there are any other questions now, just post them. Again, growth hormone is safe. It can be expensive. There are other therapies out there. So the last question is growth hormone really the fountain of youth? I'm going to let you be the judge. My personal opinion is that, yes, it can improve your quality of life. It can improve your overall health. If you like this talk, please give me a like, tag people on this video. There'll be a replay on my page. And I'd just like to briefly talk about my health coaching services. So if you see what I talk about on the videos, if you have a challenging medical questions, or if you have issues that you can't solve with your doctor, you're not feeling well, you can't figure out from all or decipher all the internet data that's out there, you don't know who to listen to, well, working with a health coach can help you decipher everything that's out there. What I do is I consult with you either over the phone or through FaceTime or through Zoom or other internet-based programs. We talk about your health. We figure out what's going on. I'll work with you and your doctor as to what blood tests you should be taking, how you should change your diet, how you should exercise, what things you should do and to improve this. Also, many times we've uncovered what the problem was, and then pass this information along to your doctor, and really help people feeling well. So if you're interested in my health coaching services or nutrition services, please inbox me. It's hey Vin, welcome to the Facebook. Again, you can catch this replay on my page. So if you're interested in my health coaching services, inbox me. And I just wish everybody a happy and healthy Saturday and weekend. And we will probably have one more hormone discussion next week. And then we're going to go into disease states. We're going to talk about, we talked about cholesterol. We're going to talk about high blood pressure. We're going to talk about diabetes. We're going to talk about Lyme disease. So there's a lot of exciting topics coming up in the next several weeks. If you have any questions, please reach out to me. I love helping people. I love talking to people about getting healthier and seeing you get all of the positive feedback of how you're responding to a healthier lifestyle. Again, you guys are the best. I appreciate all of the positive responses that I get about this talk, and I really, really appreciate it, and I hope you guys have a wonderful, wonderful weekend. I'll see you all next week.